literally explained what DK is, what HHS is, and then what kind of complications it can cause, which finally led the son to be convinced. So I think that was one place where I strongly advocated for the patient, because he was like unable to tell anything for himself.
Yeah, next question would be, tell me a time when teamwork was important.
Yeah. So I think very recently, when we had a research publication, which was research was kind of very new to me as well. But I think during that publication, like review article which we were writing, I think that was a great example for a teamwork, because I was also new, my colleagues were new, the mentor was, but she didn't have a lot of time to, guide us very well in the time that she had. But otherwise, I think as a team, we had all worked together. We had organized meetings for ourselves, where I was the one proactively doing, giving this idea of organizing meetings for ourselves. And then I was also trying to explain people what I have understood. And I think that was one time where we all worked as a team to get the article out. And yeah, and also I felt like that was a very good time for me, as I felt very happy, like taking the charge, taking the team lead and organizing these meetings and reading up myself so as to explain to everyone what I have understood. So I think that was a very important time to be as a team, because all of us were new to the research field.
All right. 3 words your friend would describe you.
So my friend would describe me as very easy to be around, a very compassionate person, and a good team player. So
And
did
3 words, sorry,
words
how your family would describe you in 3 words.
sorry?
How about your family? How would they describe you in 3 words?
So my family would describe me as very hardworking, because they've seen me like work my ass off all these years, and a very caring person, and very fun. Yeah, I think they would describe me as a fun-loving person.
If you could improve one thing about you, what would it be?
So if I could improve one thing about me, I think it would be self. I tend to be a little harsh on myself, a very self-critical person. I think that sometimes tends to be a little on the downside of it, because yeah, it's very difficult to like come out of situations if I tend to be very self-critical. I'm working on it. Like I'm trying to take it a little bit easy on myself, but I think that would be something I would love to work more on and improve.
Tell me one of your greatest accomplishments in your career.
That's a great question. So one of the greatest accomplishments in my career, I think, would be, can I take a moment here?
Yes, sure. Take your time.
Can you tell me about a time where you had to advocate for yourself in your medical career?
For myself.
Yes.
Yeah. So I think this was one time where, so it was like, I was in the OR, I was in my OBGYN posting, and I was in the OR for the first time. And so this was also the first time where I was asked to put a Foley's catheter. So I ended up doing a little mistake. So I put the Foley's catheter into the patient's vagina, then the urethra, and then the attending ended up shouting at me in like in the whole OR, where every department involved was there, anesthesia and OBGYN, and the patient was still awake. Like the patient didn't complain, but because I think she was already anesthetized, but the whole department was there, the patient was there, and I was having a hard time telling the attending that this was my first time. But then I finally like took her aside and I told, like, I'm really sorry for doing this, but it's really my first time. Can you please, tell me a little more how to do this? And then I think then she understood that, okay, fine. And then she apologized too, that, okay, fine, sorry, I didn't know that it was the first time. I shouldn't have asked you to put it directly. So I think that was one time I really had to stand up for myself because I had like gotten yelled at in front of a lot of people. So she did apologize in front of all of them too. But yeah, I think that was one time where I had to like really stand up for myself and not take that. Yeah.
Okay.
Can you
Dr.
can you
Divya, I have a suggestion. I don't think so you have to use this example. I don't know what others would say, but
Okay.
I think so that was like, I don't know. I don't know what others would say, but I don't think so you should use that example.
Yeah, you should. I mean, your senior apologizing to you doesn't really sound good. So we don't want that, no, during residency, that somebody senior should apologize to us. So
Mm-hmm.
yeah, avoid this. You can think about it and yeah, or maybe just rephrase it that you did stand up for yourself and then the senior doctor understood. I mean,
Okay.
that just don't say that she apologized to me in front of everyone. That doesn't yeah, put a good picture.
Okay.
Yeah, I agree with what the others said as well. I just wanted to ask another question. Could you tell us a time when you had to assume the role of a leader and sort of give us an example of how you face that situation?
Yeah. So I would like to talk about my recent rotation where so we were all kind of the every 4 weeks the people change. So when during my initial rotation, like when my initial start date, I think we were all fairly new. But and also the my peers who were there with me were, they were, most of them had their first rotation as this one. But me being experienced with my previous year of two and three rotations last year, I think I had taken the charge to teach all of them where as to how to use the EMR and what to do, how to approach the patients. I think that was a very challenging thing for me because there were so many peers who were fairly new to the system. So I think that was one time where I really took charge, and the attending also gave me a very good feedback saying, these people, the other students that you have taught are doing exceptionally well, and then you yourself are doing very good. So, I think that was one place where I really took charge and portrayed that I could be a leader. Yeah.
I have one question. Um, if you were to write a biography of your life, autobiography, what would be the title of it?
I haven't really thought about the biography title. I'm still like working on this answer. So, yeah.
All right, if you can have dinner with anyone, dead or living, who would it be and why?
Okay. Can this answer be the same as Dr. APJ Abdul Kalam? Because I really like look up to him.
Yeah, I think can be saying here.
Yeah. So, yeah, I would really love to meet him so that I can really understand how he came from a very poor family, and then he became the president of India, and then he's also called the Missile Man of India. So I feel like a dinner with him would like really give me a lot of motivation and great advice. Yeah.
Sorry, did
I
you
have a
already tell
question.
us? No, carry on. Sorry.
You can go
Sorry,
ahead.
go ahead.
No, I was just going to ask. You might have already been asked this, but did you tell us about a recent book that you read?
Yeah, I did tell that
All
I
right.
read. Yeah.
Okay. Sorry. Yeah, you can pass.
Okay, so Dr. Divya, how do you identify yourself? Do you identify yourself as a team player or as a lone hustler?
I would identify myself as a team player.
And can you support your answer?
Yeah, so I think working in a team would, for me personally, I think working in a team would give me better outcomes because it's like, one brain versus five brains, I think is a much better place to be. And I would love to like know everybody's opinions so as to get the best outcome possible. So I think I personally am a team player. Yeah.
Very nice answer.
Can you tell us about an interesting case that you've recently encountered and what you've learned from it?
Yes. I think that most of my answers are being repetitive. So is that fine? Because, or
Oh,
no?
I apologize. Sorry, I missed a lot of your interview. So if that's a repeat question, I apologize. We can skip it.
No, because I spoke about the unilateral kidney stones, which was like recurrent unilateral kidney stone. It's still in progress. I know people are still waiting to diagnose it, but I think that was by far the most interesting case that I've seen. It was very like yeah, I had researched a lot about what could be the reasons. So I don't know if it can be repetitive or should I like write down a lot more interesting cases that I've seen.
No, I don't think they'll ask you more than one, to be honest. I mean, on the safe side, you could think of maybe two or three cases, just in case, in a different context, they might ask you another question, and you can reflect on another case for another different example. For example, to illustrate teamwork for another case that you worked on, right? So
Yeah,
just, I guess, yeah, just be prepared for maybe two or three
yeah,
different
two or
clinical
three.
scenarios.
Uh, okay, who is a physician role model for you? And give one example of physician role model and one for bad role model.
Okay, so for me, a physician role model would be back home in my internal medicine professor. So his name is Dr. Harikishan, and he is, I feel like he is one of the best doctors I've worked with till date. Like the way he approaches a patient, the way he approaches a diagnosis to a case, and the way he conducts himself, the way he teaches the students. I think he was one of his classes I still remember till date. So for me, I think if I'm even like half as good as him one day, then I think yeah, I'm doing great in my career. And a bad role model would, I have I've never felt like somebody is very bad till date, but I think somebody who would like not listen to their patients actively or like be doing multiple things when they're with a patient, I think that would be a very bad physician role model.
You mentioned that one of your role model is Dr. Hari Krishna, if I'm right.
Yes, yes.
Yeah, and you are inspired by him. So, what brings you to the US? I mean, he's in India, practicing in India. Why do you want to come to the US?
So for me, those are two different things. So I would always go back if I had the chance. I would always like keep in touch with him and learn from him continuously. But for me, US is something a little different. The reasons. So first thing is I've always like thought about US as a place where I want to be. So, and coming here and my experiences here with like rotations and in general, I think made this stronger. So during my rotations, I've always seen that the care here is very like, sorry, I'm just blanking out. Yeah, but the care here is very patient centered. So everything is like tailor made for the patient, and I really appreciate how strongly evidence based medicine is practiced here, and also the emphasis on preventive care in the US. So I think these things are very inspiring for me to be in the US in from a clinical point of view. And also I have a few close family members here. All my dad's brothers are here. So I think I do have close family to be around in the US. It wouldn't be like a very new thing to me. And personally, I love exploring new places. So I think that is also another reason to be in another country altogether. Yeah.
I think you combined like 4 different answers into one answer.
Sorry?
You answered like 4 different questions into one answer. So you sort of in this question, you also answered why do you want to come to US? What is different between US and India? What are some of the, will you be like lonely here or not? Do you have any family here? So you sort of addressed all 4 questions. I would try not to do that.
Okay. Sure, I'll take that into account. Yeah.
You also, we did it for like 30 minutes. Everyone is doing good. You were good. Yeah, my feedback. I don't have anything where you can improve upon. Yeah, you have to still work on few questions because you are kind of blanking out
Yeah.
a few questions. But that's okay. I mean, we were just bombarding you with questions from everywhere.
So
You were good.
basically, never answered the question where I gave up for myself or advocated for myself. So I just uh, put up answers which just came into my mind at that moment. So I'm thank you for these questions because I think now I'll also like think about what I want to answer. Yeah.
And I think this is a very good way we are doing
Yeah.
for the last interviews. Like everyone is bombarding, and it feels it feels like nervous situation. I think it will be good for practice. Yeah, I think for
Yeah,
tomorrow, from tomorrow, we can start doing for everyone like this.
yeah, I think you did really well considering the questions because to be honest, I was trying to in my mind answer some of them and I really couldn't. So, um, but yeah, I think it might be worth actually just giving it a shot anyways, just to see how you can perform under that kind of pressure. And you might even surprise yourself, right? You might even, as you're talking, something might click, and then all of a sudden you'll just go, right? I've sort of experienced that. But yeah, because you know, just to sort of towards practicing towards the actual day when they ask you a question, you know, you won't be able to say, oh, can I come back to that? Or maybe you can, you know, I don't know. Maybe that is a good thing to say, and then, you know,
So
you can probably just bring it up
gave me
later.
saying if you cannot really come up with an answer at that moment, you can just say, can I frame an answer and get back to you?
Yeah,
I think
yeah, I think that's
yeah.
So
You
yeah,
can,
and
according to me, you can say it. That's what I think because we cannot just come up with random scenarios suddenly. We can always say, can we revisit this question again? I think it should be fine.
yeah, that's a good point. No, that's fine. That does make sense actually.
all right. And
Yeah.
like, do you think like my tone was anywhere nervous, or was I fine with that?
Yes,
Did you
it
feel
was like,
nervous?
oh, okay.
Sorry.
Did you feel nervous? Or...
So I did feel nervous when I was like facing questions which I didn't have an answer to at that moment. So
I believe that's okay. It's fine because it was like a 30-minute interview, and you were the one who was talking the most. So it's fine. That happens sometimes. It was not very bad or something to be pointed out at. So you were pretty good, I would say. Not nervous or something.
and do you think any of my answers were like did you find any significant flaws which I can improve upon?
I
All
can
right,
come
so
up
I
with a
thought,
Small flaws. Like Dr. Aribas mentioned that I answered 4 things in one question. So that's something I can work on, yes. And anything else that you felt? Like in
yeah,
any,
one
so
more thing. Uh, sorry, just the fun thing, the fun fact about you. So that's something they ask when you're introducing yourself with the residents in the resident meetup time, and they go like, introduce yourself and tell us a fun fact about you.
right,
So that's a yeah. So try to come up with a better fun fact, I would say. Just something
right.
interesting for them to remember you by.
Yeah, definitely. And I'll just say one thing. I honestly, I think I missed the first maybe 15 minutes of the interview, but the rest of it, to be quite honest, the content of what you were saying was very good, right? Your answers were very good when listening to your words. But I think you should definitely be more confident because what you're saying is very good and very on point, right? Does that
Mhm.
make sense?
Yeah,
So
it.
have more confidence because what you're saying is actually really good. Like your answers are very well thought out. Like you've clearly taken time to think about these questions, right? Like who's your inspirations, things like that, right? So that's the one thing I would say, to be honest with you.
Thank you. And
And why you want to come to the US? Like Dr. Reba mentioned, you are mentioning four like answers to four questions. To me, it sounds nice because you have multiple reasons to come to the US. It's not just one reason. So you can always say that you have family here, and I mean, phrase it in a way that sounds like you want to come to the US because of all these reasons. But yeah, it sounded okay to me. Just rephrasing needs to be done. Otherwise, you can answer all these points according to me.
okay.
Yeah, like organize it better. It didn't sound confident enough for me. Like for
Oh,
me, it was like, just throwing everything in there and trying to
okay.
convince me that you want to come to the US.
Yeah,
I would say organize it better to make it sound more convincing for sure.
yeah, makes sense. And also, I wanted to know that about advocating for my patient. So, is that a correct or is that a good scenario to talk about where I really like try to convince the son because the patient wasn't like talking anything? Do you think I should like change the scenario, or do you think it's a good scenario to talk about?
So it's your story. So yeah, it's not right and wrong. So whatever
No,
you
but
think.
no, I wanted to know if it addresses the question of advocating for my patient.
I think you can use that story. In that story, I would like you to make sure that you mention the fact that the patient was not capable of giving consent himself,
Mhm.
and that the son was like did have the power of attorney at that moment to make the decision, and you had to advocate in the sense that you really had to understand what was his reservations from the son side and how you dealt with those. So you did address those things. Again, just organize your answer better, make the story more convincing.
Sure. Yeah. Any other feedback? Yes, thank you so much. So anybody else wants to give their interview?
A few questions if no one wants to go next, unless someone wants to give their interview next.
Yes, I think we can. I really want to know, like, what would you have told about a situation where you gave up? Because I couldn't, like, really think of any even by the end of the interview.
Don't think of a medical situation. I would be like, I tried to learn
Medical
how to
situation.
ice skate, and I gave up because I fell so many times.
Oh, so like any random thing, like even a small thing.
Yeah,
Oh,
any random thing. Why do you have to make it about medical unless they're asking specifically? And I don't think they will ask in medicine if you've given up on anything.
yeah. But in life, right? So I was just thinking about any like significant or very bad scenarios. But okay, then now I get a better view of it. Fine. Thank you.
I mean, just for brainstorming purposes, I mean, if it is something medical, I would definitely stick to something like very, very basic and something that a junior doctor would do. For example, you've been asked to do put in a cannula on a patient, and you tried like two or three times, but of course, you stop trying after the third time because of patient discomfort and things like that. So you gave up. Not that you gave up, but you felt like you did the right thing and you escalated to your senior. But then definitely you could say something along the lines of how you didn't let it discourage you, but basically just kept practicing and these sorts of things, right?
Yeah, like that can be used
Yeah.
in the sense that you gave up in that moment on that particular patient, but you went back and refreshed your skills and you were able to continue with the other patients. So it's like you stepped down in that moment, but you didn't back off of the whole patient care or the specific skill you were lacking.
Yeah, that makes sense.
Questions I think that was asked for Divya was Tell me about a physician, like a negative physician that you don't want to be like. Anyone has any ideas for that? I understand the physician role
So
model one, but like for the negative one.
yeah, no, I definitely have an example that actually happened to me. I, actually, it's good for me to get some feedback from you guys whether this is a valid answer. Basically, we had a consultant who would see patients, but he would literally stand by the doorway and not really fully examine the patient, right? And it's something that we all notice as junior doctors. So yeah, it's something that always stuck with me, and I always kept it in mind how um, that's definitely something that's bad practice, and yeah, I don't know if it's worth mentioning that.
Also, like the answer I mentioned was actually about a physician. I really didn't know if I can say it out loud or not because my previous rotation, the physician was like, he always used to sit in the room with the patient and look in his phone like all the time. Even after us mentioning like 100 times what he's going through, he would like. So there was this scenario where the patient's brother was admitted with COVID and he was like intubated and stuff. And then we had mentioned that to the physician, and then he went ahead and he's like, are there any recent stressors in your life? So I'm like, I didn't think it was like very good of him. And he always, sometimes he used to like swipe Tinder and stuff when we are presenting the cases. So I think he was one person which I felt like, okay, I didn't want to be like that person. I didn't know if we can say it out. I didn't know if I could say it out loud or not. So I just refrained from saying that somebody was like that. But I said the qualities that I didn't want in a person or in a physician.
Yeah, like I can think of a scenario where one of our senior surgeons was a very rude person, and every time he would walk into the room, everyone would stop talking, and no one would want to work with him because he was so rude with everyone and with all of his junior doctors and his residents. And I think that is something I don't want in myself as a physician in the future. I don't want my junior residents to be scared of me and not want to work with me and talk badly about me behind my back. So I can think of that scenario probably.
Yeah,
Also,
that's actually a really good example, and I think you could also spin that into a personal thing by saying, well, exactly what you just did, right? By saying that you would want to be approachable, and you hope that other juniors in the future, you wouldn't want people to see you in the same way that you saw this consultant, right?
Yes.
Yeah, exactly. So, yeah. Yeah, I think that's a really good example, actually. But I think about it, there are a lot of consultants who are actually intimidating, are not approachable, and
Yeah, especially in surgical
yeah, yeah,
faculties, like so many of them are like
especially,
that.
exactly, yeah.
How do you guys have any scenarios for about a specific time where your performance was criticized?
I had another story like where the consultant like just so in India we have like physical discharge summaries, physical health records. So she just threw the discharge summary, like she crumpled the paper and threw it away, even though everything was like perfectly there. So I think, do you think that is a story that I can put forward instead of like the Foley story where I had to advocate for myself? Or like,
Can you tell the story? Like, how did you advocate for yourself in this scenario?
yeah, so I think yeah, so that what happened was it was like we were on a night shift and then the patient was like leaving in the early in the morning, so we had to get the discharge summary done by like 6 a.m. So we sat all night and it was a very long stay, so we sat all night and then we did everything, and then she just crumpled the paper because of some small thing she couldn't find in the summary, and she just yelled at us again like in the whole labor ward in front of so many people. And then we had like politely told her that, we took the crumpled paper back and then opened it and then we showed like, see, it's all right here. And then she said, okay, fine. And then yeah. So I didn't know like if we can use this story or not. That's
So, Divya, how did you advocate for yourself in this scenario? That's
okay.
my question to you.
I think maybe I should just put forward more points as to what I did for myself to show her that it was
Yeah.
okay.
Like one story I can use in this scenario is that um I did an orthopedic surgical rotation at an outside hospital, a huge tertiary care hospital. and their entire orthopedic ward was filled with male residents and male consultants. So I was the only female, and I was the fourth year medical student rotating. So they really didn't care about me. So I wasn't allowed to assist in any of the surgeries. I was mostly kept outside of the OR and be like, you don't need to come in. Girls don't go into orthopedics and things like that. So I spent the first 2 weeks of advocating myself in every single way possible, that I would talk about how I just want to observe the surgeries, let me in, and then be actively participating or asking questions during the procedure with some of the junior residents, try to show my interest. And then I started asking for permission to assist in some of the smaller or easier surgeries. And through that, I built their confidence in my capabilities of being able to assist in the surgical procedures, or be able to be present in the OR. And that's how I advocated for myself in that sort of scenario. So I can use that story. I've just tried to word it in a different way, but like that's an example of how I advocated for myself in an environment that wasn't very welcoming for me.
Got it. Yeah, that helps. Thank you. Talking about criticism, I'm really sorry. It just popped up in my mind like another story.
No, that's fine.
I just changed the topic. I'm really sorry about that.
That's okay. What was the question? What did I ask?
Criticism.
Yeah, about a time your performance was criticized, like a specific time. I know we all answered the question, we take criticism very well, blah, blah, blah. But what about a specific time? You guys have any examples for that? You're quiet.
I would go with my fistula case again, saying that I was criticized that day, saying that you have to know about the fistula, and I took it positively. I could say the same story again, I think so. The dialysis patient.
I do have a story. So this was during my medical school days in my third year surgical rotation. I worked up a case and I did not present it properly. It was a carotid body mass, and I, instead of saying there's increased warmth, I said it's warm. So I was criticized in front of the whole department, vascular surgery. Yeah. So after that, my presentation skills have improved. I took it positively. So you can just mention that one. I'm sure everyone was scolded in one way or the other during medical school days. That could be a criticism.
Yeah, that's a good example. Okay, something like that.
Can we talk about a situation where we missed something in the history and then we were criticized for it?
Yeah.
So there was this one patient who came in with a UTI and we missed asking the obstetric history because it was like an unknown patient. And then finally, the senior resident figured out that she was pregnant. So she's like, "Why didn't you mention that?" So do you think this is a story that I can like phrase it properly, but you think this is okay to mention?
Yeah, and after this, you can say every time a lady comes to my, whenever I take any history of any women, I always make sure to ask this history, pregnancy history.
Yeah. But do you
Yeah.
think it's okay to mention the story?
Yeah, I mean, it's your story and it has happened with you, so you can definitely mention.
Okay. Thank you.
Sorry, do you mind if I just give an example of a time where I was criticized, and just to see if this is an appropriate answer? Essentially, it was my first week when I was an intern. A patient came in during the night, and I clocked the patient in, drew up the drug chart. Patient essentially came in with diarrhea and was we had to give her some IV fluids and then just basically keep her in for consultant review the next day because it was so late. So when I did her drug chart, I put all the drugs. She was on furosemide, which I didn't cancel. I didn't note that to not give it to her the following morning. The next morning, when the consultant came in, he pointed it out right away. And immediately I felt so bad about the situation. But looking back and on reflection, I was so concerned about making sure I get all the small details right, write all the drugs in the drug chart. And I lost track of the big picture of thinking about the patient and what she came in with. So I sort of lost the big picture when my head was more in the details. But it's something that I definitely learned from and was more sort of cognizant of going forward. I don't know if that's a little bit revealing too much, but I mean, mitigating factors is that it was my first week, still sort of learning and a little bit overwhelmed with, with being an intern.
I missed your ending. Did it affect the patient in any way? What you did, you entered through Usmle. Was it
So no, no,
negative?
no. No. So basically, the consultant caught it. The consultant knocked it off and made sure the patient did not receive it. But the consultant did tell me that this medication should not have been. I mean, it was supposed to be on the drug chart, but I was simply supposed to put a cross so that the patient did not receive it the next morning. So luckily, the patient was not harmed by the situation. But it was just basically more of a learning point for me in terms of keeping the big picture in mind. Actually, now that I mention it, now that I've spoken about it, I don't think it's a good example to give actually. Yeah. What do you guys think?
It's fine, but if you can come with the other better examples, it would be better. But this one will also go, I think. Yeah, you were criticized and then you improved. So, and it's your story.
Yeah, fair enough.
I
I guess
mean,
I should talk more about how I improved. And I guess an important thing to mention here is a consultant did give me some really good advice. She said that basically, as doctors, you are going to make mistakes. And if you don't make mistakes, it's either because of one of two things. Either you're extremely lucky or you're not doing enough for your patients, right? So it's not about whether you make mistakes or not. We will make mistakes, but it's more like how you come back from it, how you learn from it, right? So
right.
yeah, that's something we can mention along with this. So if I give an example like this, I think it's important to talk about how I reflected on it and sort of debriefing with the consultant about the situation, just to I think talk more about that than actually dwelling on the mistake itself during the interview, right? So
Yes.
Yeah, I think
Learning
that's
point.
yeah.
And also, I would like to ask if any of you have like thought about you if you really don't have a situation for like a small thing, is it okay to use like someone else's story, or is it better to say that no, I have not faced such a situation, but if I would have faced it, I would have dealt it in this manner?
I would definitely say think about the mistake because I think if we think hard enough, we've all made some kind of mistake. But I think the key is really sort of digging deep and finding a good example, a good something that is not overtly bad to the point where you're like eyebrows are raised, but at the same time something that can be understandable, something that can happen to anybody, right?
Mhm.
So I would definitely try and dig deep here and find something to talk about. And again, I don't know, keep it general as well. So I think probably think of something outside of medicine just in case, like a mistake that could have happened, maybe like some kind of family thing or whatever, right? But yeah, but generally maybe medical related though.
Also, Divya, answering your question, I think depends on the question. If they ask you, tell me one mistake you've made or the time when you were criticized. These are the things which we face daily. And if
Yeah.
we talk about it, it means that we have self-reflection. We are self-aware of what we are doing. But if there's a question like, tell me a time when your integrity was tested, that's not something very common. And that time you can mention that, unfortunately, fortunately, I haven't really come across the situation. But this is what I will do if something happens. Uh, so it depends on the question.
Okay. Yeah, makes sense.
Yeah, and if you were trying to ask that, should you make up a story if you don't have one? My suggestion would be if you've not pre-prepared that story, don't use it. And that moment, you have a lot of nerves. And if you're trying to make up a story at that moment, you're going to get caught. In the sense, they will realize, she's making shit up that she hasn't done or hasn't experienced. So I would refrain from doing that. If you don't have a story or a solid story to back up your answer, you can always say, I haven't experienced this. And yeah, and if you were to experience, how would you handle it? I would refrain from making up stories in that moment.
Got it. Yeah, makes sense.
Does someone want to answer? Tell me about a time that you worked very well under high pressure.
we like tell about COVID if
Yeah,
that's
I
okay?
think COVID is the best case scenario here because the stakes were high. So
Yeah, because I think that is one place where we were really stressed and like we were supposed to work in PPEs for like 16, 18 hours. So I think that's also like pressure and also we were expected to perform well. So I think I would go ahead with a COVID story. I mean, do you think it's all right? Or
Yeah, definitely. For sure. If you were working during COVID, as you know, I mean, hospitals maybe had changing needs. Maybe they told you to work in a different department than you're usually used to. So you have to
yeah,
be adaptable. Teamwork, you can talk about that. So a lot of things you can apply to this question, right? Teamwork, how that was necessary in order for you to complete jobs. Understanding with colleagues, everybody working a slightly different role. Yeah, yeah, I think it's if you were working during this time, then yes, for sure.
Also, if you can just add, make it sound more challenging, like there were multiple patients, like patient overload was there, and shortage of bed, shortage of oxygen, like what we face in India. So if we can just put that and uh, make it sound more high pressure situation, that will sound very nice.
yeah,
You were working for 16 hours, there was shortage of beds, patients were dying, and yeah, just make it more dramatic, I think. A little more dramatic. Yeah, it sounds like a high pressure situation then.
Yeah,
And then you can
definitely. And also seeing patients in the corridors, right? I'm sure maybe that happened in our hospital where we saw patients in unusual parts of the hospital where you would never otherwise see them, right?
yeah.
Um, yeah.
I have a different story. Like I have thought about this answer one. So this my answer for this question is also my answer for my leadership skills. So there was this time during my medical school we were having Christmas batch party. Everyone was dancing and having fun, and one of my batchmate threw a seizure. And we were just in second year of medical school, so everyone started panicking and nobody knew what was happening. So I took up charge and I made sure that I'm delivering leadership skills and making sure that prompt and coordinated actions are taken. So I asked my other batchmates to call for help, and we made sure that the space around the person who was seizing is clear. And yeah, and then we took her in lateral position, and her seizure spontaneously stopped. And this is what I learned from the situation. I still have to phrase it well, but yeah, this. So this, how is this example for high pressure situation? Also, the same answer for leadership skills.
I think personally, I feel it's good, but I don't know what others would feel like. And listening to your situation, I just recollected that the same thing happened in my apartment. Like one of my one of my friends threw a seizure all of a sudden. Like I'm like, okay. But I didn't do actively anything during that time because I was like in eighth grade, ninth grade. So, but yeah, it just reminded me of that. That's it.
And actually, it reminded me of something which is, I think, a really good example of a high pressure situation. So I was in the cardiology unit, and in fact, it was a relative who came to pick up her to pick up a patient to take home. Right? It was in the department where patients get sent to right before they get discharged. Right? So it's a very stable part of the hospital. And I was just there doing the discharge note. This relative came into the ward to pick up the patient, and out of nowhere I see her in the corner of my eye begin to choke right on something. I did not have any time to think. I just approached her. I realized what was happening. She was literally choking on something, and without thinking I automatically told her, the first thing I said, are you choking? And she just was like, making some movements with her hands and saying yes. So I told her right then, I'm going to deliver some back blows, put her in a position, gave her like 3 or 4 back blows. The chocolate, she was able to then cough it up, and it all happened. Felt like it was maybe a minute or 2 minutes long, but it literally all happened within 10 seconds. Um, and yeah, it's something that I do sometimes reflect on. And I remember looking around, and actually nobody saw it. And I tried to tell my colleagues, and I don't think many people believe me, but there was a student nurse who came up to me and said, "Oh, that was quite nice what you did for that patient." But yeah, that's an example. I don't know. Does that sound? I mean, this really did happen, but not many people, I don't think, believe me, to be honest. But is that is that I don't want to use the word convincing, but does that sound like a good answer for that?
For me, it sounds like a very good answer. I think you should refrain from saying nobody believes me and then be like, everybody told, like everybody, or you can just use a little
Sure,
bit
sure. No, no.
phrase.
It's not that nobody believed me. Not that nobody believed me, but a lot of people were making fun of me for telling the story in a dramatic way. But it felt that way, if that makes sense. But I hear your point. I'll definitely not say that, right?
And you can phrase the story in a certain way where you were the person who delivered to save the patient's life. It doesn't matter who didn't see. So I think
Right.
telling those parts of the story. But I think the story as such is a very good one because it is
Yeah.
the question theoretically.
Sorry, Divya. You're. Is it just me? It might be just me and my connection here, but I think you're cutting out. Actually,
Hello, can you hear me now?
oh, I can hear you now. That's great. Yeah.
Yeah, so I'm saying that it would be better to refrain from telling that people saw, didn't see, or anything because theoretically we can all answer that if someone's choking you do Heimlich or you get back blows, but like there are only few people who would actually deliver those under pressure, you know.
Sure. I think, to be honest with you, I think anybody would do it because you don't have time to think. You just got to do something. So, but fair enough. Fair comment. I think, yeah, thanks. I'll definitely not mention about because it makes me sound like I would have wanted somebody to see what I was doing, right, and get some kind of a recognition.
It's better
So,
not to say anything about that. Just don't say
yeah,
people didn't see nothing of that. You can say that that was some very pressureful situation because nobody was
yeah.
around.
Sure. Fair enough. Yeah,
I was alone helping.
yeah. All right.
Did end up
Yeah,
saving the life.
yeah. That's fine. Thanks. Yeah.
Discuss any question?
I wanted to discuss the biography title because I have written this question like at least I think in the beginning of when I started preparing for the interview questions and I could not come up with anything. So I don't know.
I did hear someone answering unfinished, but it's Priyanka Chopra's title, so I don't think we should be copying uh, other people titles. So just come up.
Hopefully, the program directors are not up to date on Priyanka Chopra's biography, if that's the case. But I
Even
think
I
that's a
was
really good
thinking of
answer.
this answer.
Yeah,
Even I was thinking of this answer, and then somebody else did mention it. So I think it's a common answer. So it becomes very general then. So if you can not come up with anything, then I think it's a good one for everyone because we are still trying to figure out our lives.
Sometimes they ask. I also heard of a question. What would be the story on the 146th page of your biography or autobiography or something like that?
Mhm. That is like very.
So I thought of putting it I would say this day, the interview day.
Or I think 146 page will be my last page because I don't talk much or something like that. So you can just end, the ending will be there.
Yeah, that's nice. But I thought of saying that it would be this day, my interview day, and I would explain them how my interview day. I met really comfortable people who felt like family to me, and that was what was described on that page. Indirectly, I'm just telling that how am I feeling with them today.
Yeah, that's nice.
One more. I wanted the answer for love versus respect. What would you choose? Or
Sorry, what did you say? Love versus respect.
like? Yeah, what would you choose? Like or love or respect?
I'd say respect, because respect has to be earned, and like uh, even if people like you, they don't respect you. So something. Respect is something which is earned. It's not something which is just given. So I would choose respect.
I
I would
heard
say
about. Yeah, you could go ahead.
no, sorry, I don't know. This might be a bit cheesy, right? But I would say love only because love is more universal and it's something that anybody can understand. It doesn't matter what part of the world you're from. You don't even have to speak the same language, but it's something that it's quite universal. Whereas respect, it can change depending on culture, right? Um, yeah, I don't know. That's just my take on it.
So that's a
I
good point.
heard, yeah, I heard an answer which said that respect can even come from fear, but like whoever you love, you're obviously going to respect that person, and only respect can also come from fear. So I think so because this usually happens in our, physician, I mean our faculty and the students. We have this hierarchy of problems, the superiority, inferiority. So I heard this somewhere saying that respect can come from fear as well. So I would prefer love. I don't know how would this answer
I
sound,
think
or
if we can combine your answer with Dr. BP's answer, then it will
My
be a
answer
simple.
is also along the similar lines. Like, if somebody loves you, they also respect you. I didn't think of the second part where respect comes from fear. That was not a part of my answer. But I was like thinking of the same thing. If with love, they also do respect you if somebody loves you. So,
Yeah, actually, I don't know if this is a quote from the movie, The Bronx Tale. I don't know, is that where you got it from? Because he talks about it, and in the answer, he gives respect, but this guy's a mafia guy, right? So he chooses respect, but that's not the right answer. I mean, there is no right answer, but I think love is probably better for the
Uh,
reasons he
I
chose
I
respect.
heard this answer from one of these webinars we did few days
All
back.
right.
So someone said
Okay.
this. I just
Okay.
remembered that.
All right. All right.
I actually
And
wanted
this,
to go for love, but I was not getting a proper reason. And I got this reason, and I felt this was really nice, that respect. Usually, this happens with we, like Dr. Ariba was speaking about. She had a encounter with a physician who was very rude, and as soon as you would enter the room, everyone would be so quiet, and probably they were trying to respect him, but that was out of fear.
Yeah.
but also it can be perceived as respect, whereas it cannot, they might not have had respect in their hearts, but I could have, if somebody is like being silent when I'm there, and if everybody like stands up when I'm there, it could be perceived as respect, whereas they are just doing it for the sake of it, or
Yeah,
like, yeah. But I
correct,
think love
correct. So that's what.
is pure, and then, it can be shown that, and
also,
also,
sorry. Also, according to Bible, love is the biggest commandment. So I think we can add that also. Love is the
Oh, that's
biggest.
nice.
yeah, that
That's
is,
very sweet. Yeah.
Yeah, nice, nice. Okay.
To end it on, I guess. I can't think of anything else unless anybody else can think of any other questions.
there's one more question. An advice to your younger self, if you would give any advice to your younger.
Oh, that's a really good question.
Yeah. So I
I would, sorry, go ahead.
I heard this question in one of the webinars, but yeah, I would like to know like what people's thoughts are. So
I
if
would say, okay, do you want to go ahead with your answer?
me, I don't
Yeah.
have any answer yet. So I just want to know what people's views are.
Okay, so I would say that I was in my earlier years, I would always believe that hard work is the key to success. But now I realize that it's not only the hard work, but smart work as well. So uh, I would give myself an advice of working smart with hard work, like hard work and smart work. I think so I would put it in that way or something.
Okay. And Dr. BP, you had something to say.
Yeah, no, just sort of on the top of my head, I think it's a great question. So was a question basically advice I would give my younger self?
Mm-hmm. Yeah.
Yeah, so I would basically tell myself that you're going to be working hard. Yeah, you're going to dedicate yourself a lot towards medicine, and you're going to be busy, right? But don't forget the small things. Don't forget the important things. Don't forget the bigger picture. The things like family, your friends. These things will pass you by very quickly. So really learn to maybe not learn, but maybe just spend a bit more time and appreciate these moments because they're going to come and they're going to go very quickly. I
That's
don't
a
know if
great.
that's nice, but
That is. I
Yeah,
feel.
yeah, it gives a
that's
bit of
nice.
balance and makes you sort of realize that there is more to life than just medicine, right?
Yeah.
Yeah.
Yeah,
I
that's nice.
yeah, I also have a answer similar to Dr. BP. I'd say enjoy each day and live each day to the fullest, something like that. Because yeah, we are working. Work is work, but you have a life apart from work. So
Yeah.
enjoy.
Yeah,
But
absolutely.
love what you enjoy what you do.
Right. I was thinking of something like, because I've always been like really harsh on myself, like really pushing myself to do everything on time, get this done by this time and that done by that time. So I think I would give my younger self an advice to take it a little bit easy and enjoy at least your younger days when you get to enjoy it. Like not as much when you're into residency or something, you wouldn't get a lot of time for enjoying in general. So I think to my younger self, I'd ask myself to like take it easy a little bit. I don't know. That was just my like when somebody asked me this question, that was just my answer at that moment. But I felt like I should phrase it a little bit better. What do you think?
Don't say that like now you're portraying that you won't be able to enjoy much now. So I mean in US
I guess
they
Dr. BP's answer was nice.
Yeah,
Yeah,
yeah, that
phrased
was a
it
very good.
well.
No, I
Doc-
appreciate that, and it was,
yeah, Dr.
to be
BP,
honest.
if you would like to like share your answer again, like I
Sorry.
just want to, I want to hear it once more.
Oh, sure.
You,
And I was just going to add something. I am an old graduate, and there is an element of a lot of truth to that, right? So sometimes, we can get bogged down into our work and into medicine, and rightly so, because the profession demands a lot from us, right? And sometimes, by doing so, we can lose track of the things that really matter, like family, friends, and these sorts of things, right? Um, yeah. So it's important to make the most of the small moments, right? And yeah, have a bit of balance because I think what I said was that these moments can pass us by very quickly. And I think that kind of tugs on the heartstrings a little bit, right? Adds a bit of an emotional edge to it.
yeah, that's nice. Thank you so much.
Yeah, no worries.
There's also this other question, which was an advice you've got that changed your life or changed your like view on life. So these are a few questions which like threw me off in my first mock interview where I'm like, okay, what? I didn't know what to answer.
So I was given some good advice. Sorry, one second. I was given a bit of good advice. It's a bit generic though. It's about goal setting. A consultant once told me to make short-term goals and long-term goals, write them down, and yeah, it's a bit
But
generic, so I don't know.
this is echoing. I don't know if it's just
Yeah,
me.
it is. I'm sorry. It's for me too. Is that better?
Yeah, it is.
All right.
Like to continue with your answer. So I
Oh, sorry. No. Basically, no. It was just about goals and goal setting. So I had a consultant who once told me how to set goals. Essentially, he said make short-term goals, what you're going to do for the week, and then long-term goals monthly, and then even longer-term goals yearly, right? So, and he always said update goals. Goals can change from week to week or even month to month, but you must always have a clear plan, as crystal clear as possible about where you plan to be in 5 years from now. So these are the things that you must know, right? So it just gives you a bit of guidance, right? So I mean, it's very generic advice. So maybe there's probably something a bit more thinking to do on my part with giving a better answer. Um, but yeah, just off the top of my head about goal setting, I guess.
I heard another answer where it said like, I think your answer combined with whatever I'm gonna say now, I think would be a very nice answer to put up, which is what do anything that you want to, but make sure you're happy in what you do. So you can probably say that whoever gave you the goals advice, you can combine it with this saying. But he also mentioned that, yeah, you should set your goals, but you should also make sure that you're happy in what you do. Not, I don't
That's
know.
really good. Yeah, no, that's fantastic. And in fact, that reminds me of advice I was given by my uncle. He said the exact same thing. And then just to add to that, he said that if you enjoy what you do, then you'll never have to work a day in your life. Something along those lines, he said, right?
Yeah,
So I don't know if it's something that we could just sort of add on to the end of that, right?
right.
Um,
I thought
yeah.
that, that your answer is really good, but I think to the end, if you can add this to the answer that you have, then it would be a very nice and complete and answer. Yeah.
Yeah, no, I agree actually, because the golf thing just sounds very sort of like just very boring, and there's nothing there to it, right? But like you said, I'll definitely add that. I appreciate it.
Mhm.
Guys, I have to go, but it's been awesome, really. Hopefully, we can see a lot more. We can do this again tomorrow at the same time. So we'll see you then. Thanks. Yeah, thanks a lot. See you.
Anybody has and wants to discuss.
Question: if someone didn't like you, what would they not like about you? I asked Dr. Amina this one, but someone else can come up with any answer.
I always thought like my answer is exact opposite of what Amina's answer was. My answer is like this is nobody has told me this, but I feel like people would not like me because I tend to talk too much sometimes, So that is something I feel like I should be working on. I should like just talk minimally or to the point and not overstep or yeah, I think that is something which people might dislike about me because I always felt like I sometimes talk a lot more than I should be. Yeah. So I don't know if that's a good answer to give, but I genuinely sometimes feel like this. People might dislike
Yeah.
me. Yeah.
I mean I mean like that's your answer. It's a personal answer. There's no rights and wrongs. Um, yeah, I think so. That can be a thing. Like for me, whenever I enter into a group of friends or when I'm new somewhere, I usually smile and just say hello, and I don't talk much. So people might I don't want to say that people might take it as if I have a lot of attitude, and I don't want to say that. I would just say I'm not so open, and I just tend to keep myself a bit quieter. So I think that this is what people won't like about me. I don't want to say I'm introvert, but I want to say that initially I don't talk too much. But once
Right.
when I become good friends and when we go along together, when we get along together, I'm the one who talks the most after that. But initially I don't. So this is what I would say. I think so. And there's no rights and wrong. Your answer is also fine.
Yeah.
Yeah, that's okay.
I will also leave now. Thank you so much for today.